Focus physical exam. I have my little person here so that way we can go through the process. There's a lot of different dimensions to this, so just pay attention and we'll be able to get through the process together. So the first thing that you want to do when you are doing a physical assessment is when you enter the room, make sure that you check that the person that you are looking for is actually the person that you're talking to. So you want to ask for 2 identifying characteristics like their name and their birthday to make sure that you're in the right room and that you are talking to the right person. You want to make sure that your patient is comfortable, whether they are sitting in the bed or in a chair, to ask the patient if it's okay that you're going to be touching them and if it's a good time, because if they're in a hospital, they could have a doctor or a nurse or other faculty in the room, and maybe a physical assessment at that point in time isn't appropriate. Always remember your safety tips. So you're going to want to make sure that you wear gloves, you wash your hands. If you're seeing an isolated person, then you want to make sure that you don the gloves, the mask, and the gown just in case of any contaminants. And you want to make sure that when you leave that room that you dispose of those things properly. So you'll start with the head area and work your way down. This is a head to toe assessment. You're going to want to start at the top of the head and remember that there are signs of malnutrition and micronutrient deficiencies that are observed instead of felt. So you want to make sure that you check the hair for any lack of luster. If there is any patchy hairline, you want to make sure that you check those. Those could be signs of some macronutrient deficiencies and changes in color. If there is like not a shine to the hair, that could be a sign of magnesium, selenium, copper, or protein calorie malnutrition. Also, any lanugo or flag sign could be a sign of deficiency. Lanugo is the very fine hair along the body, and so that could be a sign of some malnutrition and some like calorie deficiencies. So you want to make sure that you check for that. It's a defense against cold temperatures, which is mostly seen in people who are severely malnourished. Moving on to the eye and the orbital area, you're going to want to look for any pale conjunctiva, vitamin B6 and B12 deficiencies, along with folate and iron deficiencies. You also want to ask the patient if they have any have been experiencing any night blindness or any other signs and symptoms of things such as altered taste or burning of the mouth and tongue. These could be signs of a variety of different micronutrient deficiencies. So the conjunctiva paleness and Biddit spots, which are white or gray spots within the conjunctiva of the eyes, is a sign of vitamin A deficiency. So you want to make sure you check those areas and ask your patient if they've had any of those signs or symptoms. If you look around the cornea of the eyes, if they have some red, slight blood vessels in that area, that could be a sign of just general poor nutrition. So you want to make sure that you're observing those things while you're visually assessing your patient. Pale tongue is a sign of vitamin B12 deficiency. So you want to make sure that you observe in the mouth, in their gum lines, because gingivitis can also be a sign of vitamin C. Taste, which is like a metallic taste or serious anything beyond normal sensations within the mouth, can be a sign of zinc deficiency. So you want to make sure that you ask your patient those important questions while you're assessing them. Moving on to the orbital region of the patient, you're going to want to make sure that you wash your hands and don gloves before physically touching the patient. You're going to look for the loss of subcutaneous fat mass within this area, and so you want to explain to your patient what it is that you're looking for and what it is that you will be doing during this time. So you're going to stand directly in front of your patient, and with your two fingers, you're going to palpate along their cheekbone to see what their fat mass is. If it bounces back directly after you have palpated in that region, then that is a sign of a well-nourished patient. If they've got a slight depression, dark circles, or hollowing in that area, it could be a sign of malnutrition. If they have slight darkening, then it could be mild to moderate. If it's darker, a little more hollow in those areas, it's a sign of severe malnutrition. Moving on to the temple region, you're going to want to explain again what it is that you will be feeling for. You're going to have your patient move their head from side to view their temple region. Go ahead and move your hand side to side. Okay, and then you're going to look along to their temple region to see if there's any hollowing or dipping within that area. If you palpate your fingers along the temple region, you should be able to feel the muscle in the temple. As that muscle is deteriorating in malnutrition, you'll have a slight swooping in that area, causing hollowing or scoop in that area. It's going to be severe. If it's just a slight depression, you can still feel the muscle in that area, then that's going to be mild to moderate. If you can really feel the muscle there and it feels similar to pressing on a folded belt, then that is considered a well-nourished patient. Another observation to view on your patient as you're just talking to them in general is to look at their skin. Look for, slow healing wounds, psoriasis, eczema. Those are all signs and symptoms of micronutrient malnutrition. If some of these signs and observations can be influenced by other outside non-nutritional reasonings. So just be aware of that. Purplish spots, petechiae as such, can be a sign of vitamin C and vitamin K deficiency. So you're going to want to make sure when you're looking over your patient that they don't have any of those signs and symptoms. As a non-nutritional effect, this can be a part of, abnormal blood clotting, and if the person is on Coumadin or a blood thinner, that could be a side effect, the purplish petechiae. And with that, you're going to want to make sure to look at the whole picture of the patient's care and make sure that that's not appearing for a nutrition-related reason. Abnormal dryness or xerosis can be a symptom of vitamin A deficiency and essential fatty acid deficiency. So when you're looking over the person or your patient, you're going to want to make sure that they don't have any scaly patches, no dry marks, in which case you're going to ask them further questions as to how their diet is and what exactly is going on with them. Edema, body edema, and swollen face can be a sign of malnutrition. So when you're looking over your patient, you want to make sure that they don't have any excess fluid accumulating in any of their soft tissues. And we'll get more in depth on edema as we go further. So poor skin trigger can be a sign of dehydration. The best section of their hand up and release it. If the skin slaps back into position quickly, then they are considered well-nourished and well-hydrated. And if it takes a second or two, that can be a sign of dehydration. Remember that as we age, the elasticity of the skin is affected, and therefore skin trigger could be delayed in those people. So just be aware of that when you're testing for that. Moving on to the upper arms and shoulder region of the patient, you're going to want to have the patient lift their arm angled like this, and you're going to take your fingers and pull between the skin between your fingers to see how much fat, subcutaneous fat, is in that position. Make sure that you're not grasping the muscle, as which it could hinder your process. So you just want to pull the skin away from the muscle and pinch it. If you feel your fingers pretty efficiently between that skin, that can be a sign of severe malnutrition. If you have, a slight bit of skin at that point and there's not as much subcutaneous fat, then it could be a sign of mild to moderate. If you can obviously see that there is quite a bit of subcutaneous fat in that area, then that person is considered well-nourished. In the clavicle region, within the shoulder and arm region, you're going to want to look for if the clavicle is protruding in any way. This can differentiate between genders. So with a well-nourished male, you shouldn't be able to visually see the clavicle much at all. And with a well-nourished female, you can see the clavicle, but it shouldn't be protruding. If you would like to palpate your fingers along the clavicle bone to feel the muscle mass, the definition of the muscle underneath of the clavicle and above the clavicle, you can do that. Visually, you should be able to see the difference between a severely malnourished, moderate, and mildly malnourished and a well-nourished patient. A severely malnourished patient is going to have a lot of dipping along their clavicle. You're going to be able to see those bones protruding through the skin. It'll be very defined in where the bones are. Looking at the shoulder, clavicle and acromion process, you're going to want to look for a rounded shoulder. If the shoulders are not rounded and more of a square, then they could be severely malnourished. You can run your hands along the shoulders to see if there is any protrusion of the bone and feel the muscle mass in those areas. If there is rounding, curved areas between the shoulders, the acromion process, the clavicle, and the neck, the patient will be well nourished. In those instances, if you are a little leery, perhaps you observe some edema at some point, just run your hands along those areas, palpating within a 2-inch section and feeling if there's any excess fluid in those areas. With the scapular bone, you're going to have the patient, I'm going to have you stand up. You're going to have the patient push against a solid object with their hand extended in front of them. You're going to look along their scapular bone here and their spinal column. In these areas, if the bones protrude, if you can visually see them throughout the examination, or if you run your hand along these areas and you feel less subcutaneous fat, there is signs and symptoms of malnutrition. If it's not well defined, but you can still slightly feel the bones, the ribs, this way the scapula sticks out, that could be a sign of mild to moderate malnutrition. You can go ahead and have a seat.